Good afternoon. This is Friday, August 7th. I'm Gary Pace, the County Public Health Officer, and we're going to give the coronavirus update. And the current numbers, California has 540,000 cases and over 10,000 deaths now. There's been some hope that things were starting to level off in the state, and the thinking was that maybe that was due to the added restrictions imposed 4 weeks ago. Unfortunately, the state is having some trouble with the data platform, and the numbers they are using haven't been reliable over the last week or so, so we're not sure exactly what's going on statewide. Lake is at a higher level than previously with 220 total cases, 24 active cases. None are in the hospital now, and sadly, we had a second COVID-related death this week. Our data is reliable since we're getting the vast majority of our results directly from the labs and the medical providers, using the state data as a backup. Bigger counties are more reliant on electronic reporting methods, and so they're more vulnerable to these problems. Our variance metrics are still below the line that would land us on the state watch list that leads to more restrictions, so we're still doing okay in terms of needing to close more businesses or anything like that. So how do we keep going in this time? All of the surrounding counties now have much higher numbers than we do. 97% of the state's population is currently on the watch list. We continue to see several new cases a day in Lake County. Many are due to contact at weekend social gatherings with family and friends. Workplaces are struggling with how to deal with a new positive case or with a contact to a case. Do I send them home? Do I tell the public? How long should they be off for? The CDC does have guidelines, and we have some recommendations on our website. Usually, if someone is a confirmed case, they should home isolate for 10 days from the onset of symptoms or from getting sampled for a positive test. If someone is a close contact, meaning within 6 feet for 15 minutes or more without a mask, they are at a pretty high risk to turn positive, and they should be quarantined for 14 days, even if they get a negative test, because that they can turn positive at any point during the 14 days after contact. If someone is a contact with a close contact, they should monitor for symptoms and maybe get tested, but they can go ahead and work. The thinking is that it's possible that these people are infected if they're a contact to a close contact to a case, so 2 steps removed from the case. But the chances are pretty low, and we can't really have everyone home on quarantine now as we're moving into these phases with higher levels of the illness. So this is our new reality, and it may go on for a long time. Employers and workers will get very good over time in sorting through a lot of these decisions. We'll be able to keep more activity going and businesses open if people do what they can to keep safe, mainly wearing masks, keeping distance, and avoiding social gatherings with other households. On the other hand, many activities need to continue during the pandemic, so people should go see their doctor for routine health care. They should get their kids vaccinated. And people should not be afraid to go to the hospital if you're sick or having some serious health issues. If we can all do our part, maybe we'll be able to keep the numbers down, keep people out of the hospital, and keep the businesses and learning environments open. Thank you for your cooperation.